Today's routine is going to work on your lower back, and all you need for this is a lacrosse ball. Now we're going to approach two areas. First of all, the top of the glutes here, with the hope, once we lose some tension in the area, that feeds some slack into the lower back, and then we're going to hit the lower back directly here with these two muscles down here called the QLs, okay? Now, what we're going to do first of all is just laying down on the floor, get yourself into a comfortable position, somewhere you've got a bit of space, somewhere where you don't need to straighten your legs out or anything here, but you do need to sort of just have this bent leg position there, okay? So, like I said, we're going to start with the glute, and all you're going to do is just rock your legs to the side just to open that up there. Just place that into any area. Obviously, don't put that onto the pelvis bone here. Go onto the meaty, soft tissue area of the muscle. And it might be at first that, as you can see, my pelvis is about an inch off the floor as the ball's into there. That will change over time, okay, as you sort of get some of the tension out there. So first of all, like any other soft tissue mobilization, what we're going to do is start off with the contract and relax method, okay? So you're going to start off, you squeeze the glute into that area, you breathe in, squeeze the glute, hold that for around 3 seconds, and then slowly relax off, okay? So make that squeeze a slow thing as well. So breathe in, squeeze the glute slowly, and then relax off into there. And again, the relaxing is slow. Don't just go squeeze tight, relax quick. Breathe in, contract slowly. Relax off slowly. And this gives your body time to ease into it. If the area is sensitive, so what we can do now, is just move across about an inch. So you can start here, do some contract and relax, move along to a new area. Again, breathe in, contract, and relax. And hence relax. We're trying to relax into it. We don't want this to take your breath away. If you go into an area and it goes, you're not going to relax in that situation. So again, breathe, squeeze, relax off. So we've done about a minute there now. I'll do about another 30 seconds. Again, squeeze, relax there. And you can find, what you find is my pelvic, the bone in my pelvis, like the SI joint, is starting to move closer to the floor now. Because the ball is just getting deeper into the tissue. If you do this long enough, everything will go flat and the ball will just kind of disappear into your glute. Okay, so now we've got that into there, we'll keep the ball in there, and all we're going to do is just keep your pelvis off the ground a little bit, and you're just going to rock from side to side, okay? So if I show you what we want from this angle, you probably see it a little bit more. Just imagine like your knees stay still and you're just rocking. And again, don't go too fast. I've said this in other videos, you want that sort of icebreaker technique where you go slow enough to break through any knots that are there. Not like a speedboat that's just going along really fast and just jumping over knots, so you want to try and smash through things here, okay? And it might be that you even come around as far as like near to your hip here, so you don't go on any bone, don't come back into the middle on bone, into there, okay? So again, we just tip up there, bring the ball into there, into that area. Breathe, contract the muscle slowly, and then slowly relax off. Contract. That's it, good. Again, bring it across slightly. Contract the muscle. So just working on across that top strip across the glute there. Good. Nice, good. So just moving, we're nearly there now to this side. So for whatever reason, the left side here feels a little bit more sensitive. If this is the case for you, like I said before, you might want to spend a little bit more time just contracting and relaxing that area, trying to get it to feel a little bit less sensitive, a little bit looser. Particularly if, like, say for instance, you're squatting, while your weight shifts to one side. I mean, generally that will happen because one side is tighter than the other one anyway, but then as a result, one side might end up working a little bit more and it just gets a little bit more muscle. Like, even if it's just muscle soreness, it might just be a little bit of that. It doesn't mean it's necessarily always stiffer. Just one side might have worked more, And that's the last bit there. Nice breath in. Relax it. Again, do that pressure wave. So just into there. Just rocking from side to side. Into that area, okay? And again, like, I'm probably going a little bit too fast there, but I nice and slow. Somewhere between where I am now and where I was. You just don't want to be doing, you know, it's not something that you're just trying to bang out quick. It's just coming across there, okay? Just another 2 or 3 seconds into there, okay? So we've loosened off the top of the glutes a little bit now. You know, this should always feel good when you like just lift up your legs, you know, into your chest here, flex your hips. So what we're going to look to do now is just work the lower back area, okay? So again, we'll just go back around to the other side. So now we're lifting up here. We're looking for that nice sort of like muscle across there, okay? Into that, come down to there, and again, ease into this slowly. If you've got a really sensitive lower back, this might like, again, take your breath away. We just want to ease into it. So again, we're going to go for 2 minutes in total. Just going to do about a minute or so on the contract and relax. And again, this goes up like, you can go up to about here with from your rib all the way down to here. Again, avoid any bone, don't come too far central that you end up just resting the ball in your spine. Obviously, hopefully you realise that doesn't feel good and just not to do that. But I feel like responsible to say that. And again, this goes to the side a little bit, and sometimes when you go to a new area, like for me then, that was a little bit, but not enough to like really take my breath away. And again, just there, across a little bit. And again, if this feels really sensitive all the time, it might be that you hit this multiple times a week, you know? If it feels okay, once a week is enough. And then sometimes you do need to just like use your hand just to adjust it yourself a little bit. Sometimes just running over the muscle in this situation, you know, it doesn't even feel good. So down there now, I'm not getting much, you know, this doesn't even feel very sensitive. Up here for me was really sensitive. So again, you'll find the areas where you feel the most sensitive, you need to work on the most. So into there. Okay. And again, what we're going to do now is just place the ball into there. We're going to do about 30 seconds of just, all we're going to do is just drop the knees to the side the ball's on, okay? So you might want to put your arms out to the side slightly, down into there. And again, find an area that feels, you know, sensitive there, but not so sensitive that every time you move, it kind of takes your breath away. And again, it might be that you just need to adjust it slightly. The reason I do it with my hand is because I personally don't like just rolling straight across on the ball. I feel like, again, it just takes my breath away a bit. If I just lift up, arch my back a little bit, move it, and then push the pressure back down, it actually feels all right, you know? Into there, okay? So, let's switch to the other side now. Again, we'll just do 2 more minutes there. So, we'll just ball into the QL. Nice deep breath in, contract the muscle, slowly relax off, okay? Again, I'm just going to leave it in that area because it feels quite sensitive, feels quite good. Up a little bit higher, so I always get, like, when I start getting up closer to my rib cage, for me, I always feel a bit more sensitive up there. I think it's, as I've transitioned to like more online coaching and spending more time sitting in a chair, you know. Good. Just move down slightly to there. Just do a few more, move into there now. Yeah, so you might feel all right just doing that. I personally don't think it's like, just keep it, you know, keep it safe really. Okay. Now, again, we're just dropping to the side of the ball, with the ball into the muscle still here. Just dropping that down. You won't drop it all the way down to the floor. You might do. Again, a lot of this depends on your, like, you know, your base mobility level when you're starting out. You know, for some people, it might feel like, you know, some areas are not that sensitive. Some of the mobilizations don't really, you know, do what other people would say they do. And other people can't even get into, like, you know, some basic positions. So everyone's a little bit different, you know. Just into there, just do another 3 of those. 2, 3.